facility if quality primary healthcare services are provided at the basic health units and RECs, and this trust is boosted of the public, they wouldn't bother to go to the secondary facilities. So that's how we envisage the system. We are signatory to the universal healthcare, and as part of that universal healthcare coverage, we have in the country a system of universal health insurance. You all know about it. But our vision is one country, one health, and one approach. So I have advised the Qawmi Sehat Card team to consult with all the provinces and come out with one uniform system. Of course, the advice was that we would ensure that 20% of the poorest of the poor are provided with free inpatient healthcare services everywhere. That's taken for. But those who have the ability to co-pay, for that a mechanism is being chalked out that with very little money they and their family are enlisted into the system and are availing the system free of cost for inpatients. So if we succeed with the provinces and design a one health insurance system, that will be a Qawmi Sehat Card system and will be implemented across the board. But consultation has started on that. It's not yet final. Once it's finalized, we will share, and that will be the biggest gift that we in the interim period can provide to the nation, with the hope that we would do and continue our best for the public, the society, and the nation. I beg leave now, but our doors are 24/7 open, not only to my health professionals and colleagues, but to every citizen of Pakistan. He or she is most welcome to inform us of the problems, to guide us, to advise us, and to be part of the system and to be part of the team. No individual or no entity and no ministry in Selo can accomplish much. We have an ambitious agenda. Pakistan has to eradicate polio, for which we have developed a dedicated, targeted, focused strategy. We will be completing 3 rounds, inshallah, by December, and we are hopeful that with the quality 3 rounds holistically and operationalized in integrated manner, the virus circulation in southern KP will be arrested, but yet we will have to take care of it for the next 3 years. So we will continue with the new strategy after that, but immunization plays a pivotal role. In my first meeting, I advised the polio team, and the same advice goes to DGFDI, that no intervention should be conducted in Selo. If polio is going for an intervention, due consultation and participation of the FDI team should be ensured. The same goes for FDI. If FDI wants to go for an intervention, they should consult and incorporate the inputs and advices and representation of the polio team. So thank you.